The reason for why we were so successful is that it was really a really massive effort from everybody in the organisation. So that board to ward connection, we had really good engagement and involvement from our executives, our board colleagues, but also all the way to our frontline staff who are actually going to be using the system and are using the system now. All of our operational managers in between, clinical staff, digital staff, all working together towards the same goal, and having that shared sense of purpose and that real commitment to every single level of the organisation, I think was the number one thing that made this such a success for our trust. In terms of the board's relationship to the EPR programme, obviously there were discussions at the very start of the process at the pre-procurement stage and the signing off of the business case. Certainly having real interest and enthusiasm from the board towards the end of the programme, just as we were approaching the final months, was really key, because what they would do would be to chair our deep dive sessions, our reviews. And because they'd had that little bit of distance, I think it was easier for them to ask those probing questions of the team that were tasked with delivering and implementing the electronic patient record programme. And so having that critical friend, that sort of scrutiny, I suppose, I think it got to those corners of the programme that perhaps we hadn't paid as much attention to as we should have done. So it really flagged to us the areas that we needed to focus on a bit more in the run-up to the launch and the go-live date. I think one of the other key things to understand is that you don't have to be a technical expert at board level to be able to know to ask the right questions. Things like, you know, have we met our training trajectory? Are we on target? Can you foresee any difficulties? Those, for example, are generic questions that it's really important that senior colleagues can ask, but you don't need lots of technical knowledge in order to ask those questions. Board members will be asking those questions or those types of questions in other domains as part of what they do day to day. So digital is just one other lens through which we deliver transformation. We implemented a series of deep dive events that took place in the months leading up to our planned go live. And what this consisted of would be a significant meeting, an important meeting that was chaired by an executive and that would have other executives present as well. And each of our clinical business units would be represented there, and the digital team would also be present. Me and my team in clinical informatics, we would also be present. And what we went through is a system of readiness checking for each of the main domains that we look at. And we divide those domains locally into 3 areas. So the first is the technical readiness. So are our digital teams technically ready to deploy what was asked of them? Are we clinically safe to go live? And so this was the preserve of me and my team in clinical informatics, because when you introduce a new software solution or a platform or a service, it can create new risk as well as solving some clinical risk. So having some really good processes and governance around ensuring that those risks are recognised and mitigated. But the third part, and probably the bulk of what we were talking about at the deep dive meetings, is the operational readiness. So are our teams ready to receive Rio? And that would be, do they have their training? So have they done their training? Have they got all the key bits of clinical functionality in the EPR that they need? And so by having this tripartite of readiness, clinical safety, technical and operational, we made sure that we were covering all of our bases. And that's why it takes a whole organisation to come together. But actually having really strong clinical informatics leadership and clinical leadership in general through the deployment of an EPR is absolutely fundamental. You cannot lose sight of the fact that this is a system that is there to aid the delivery of healthcare, and that's delivered by healthcare professionals for the benefit of patients. So if you don't have strong clinical leadership in your EPR programme, the risk is that you end up deploying a system that doesn't quite work for your staff on the ground. Yes, you are deploying something technical, but actually all it is a means to deliver healthcare more effectively and efficiently. And actually, that's why you need the clinical leadership, because it's that clinical change, that transformation piece. That's about people. It's not really about technology. So if you've got board level support for ensuring good clinical input, then I think you are starting with a really, really strong foundation for the future.